Good morning, everyone. My name is Veronica Judy Cecil, Senior Deputy Commissioner for the Kentucky Department for Medicaid Services. We're so happy to have you on with us today. This is a great participation. We've had little attendance for the live version of this stakeholder meeting. So happy to see you all on. I think we have a lot of really great information to share for an update on what's going on with Medicaid unwinding. And so we do try to leave time at the end of the presentation to open up for questions in the chat. We did get some questions prior to that you all sent as you registered, so we'll try to touch on those as well. But Helen, let's just go ahead and get started. So we always just try to remind folks what's happening. We are unwinding from the public health emergency that officially ended on May 11th. That has required us and us as Medicaid to restart annual renewals. They were on hold during the 3-year public health emergency. So we are now in the process of going through those renewals. We allocated the cases across the 12-month unwinding period. So that's why people or Medicaid members may see a different renewal date than they might have had prior to the public health emergency. We have a lot of new folks that have never gone through a renewal. So very, very different for all of us as we move forward in the unwinding process. We always like to show a snapshot of what's been happening. It is no surprise to us that our enrollment is starting to trend down. We knew that as we moved through the public health emergency, we were maintaining continuous enrollment for all individuals who were enrolled. So we were not permitted to take any action on a change in circumstance. If somebody's income changed or their category eligibility changed, we were not able to make any changes. So we did have a very high enrollment as we started into the unwinding period. And our system did its best to continue to try to check individuals' eligibility. And so that was all going on behind the scenes during the 3 years. So we were able to identify as we started into unwinding that there were individuals that were going to lose coverage or Medicaid eligibility as we started the restart of renewals. So again, not terribly unusual for us to see that it is trending down. So now what we'd like to do is always show kind of a snapshot from each month of renewal. This is based on the CMS monthly report that we file with CMS. This is posted on our website, our unwinding website, so you can go out and look at each month's report. It's due on the 8th of the month for the previous months, so the previous month reporting period. And that's available again to everyone and we post it as soon as we've submitted it to CMS. We generally get it out on the website, not too far past the 8th of the month. So this is just a snapshot of what August looked like that we reported to CMS. There were 54,344 individuals that were up for renewal. Of those, we were able to approve 28,296. We terminated 18,662. And we have this pending bucket. We have 7,386 that had an August renewal that ended up being pending. It's pending if there were documents that were responsive to a notice, so a request for information or to a renewal packet. And the member submitted documentation, but state was unable to process that prior to the renewal due date, so that individuals' coverage gets extended until the state takes action. We do not retro terminate somebody in that situation. Once the documents are processed, if the person's determined ineligible, then they'll have their termination effected at the end of the next month. Or end of that month that it gets processed. So those folks maintain coverage until that happens. Also in the pending bucket are individuals that we are extending. We do have a couple of flexibilities right now. We are extending long-term care and 1915C members. If they have not responded to a notice, we're permitted to extend them for up to 2 months. So that gives them additional time to complete that renewal packet or respond to that request for information, and gives us more of an opportunity to outreach to those folks to make them understand that they need to take action. We are also doing the same, but for 1 month for all other individuals. So we were able to last month implement a 1 month extension for anyone else who might not have responded to that notice, to give us additional time to complete outreach. So now looking at the September cohort, so these are individuals who had a September 30th, 2023 renewal due date. We did have a large number starting in September, 150,985. The reason for that, why you're seeing a larger number starting in September, is we had pushed a lot of cases where there was a child on the case. And the reason we did that is because we were going to implement systematically continuous coverage for children. What that is a 12-month continuous coverage for a child that's determined eligible. And during that 12-month period, we will not process a change of circumstance that would end coverage for that child. There are only a few reasons why a child might get disenrolled during that period of time. One is that they turn 19. The other is that the child moves out of state. A third is that the child's guardian or parent requests that the child be removed from the Medicaid program. Sometimes that happens if the adult has received employer insurance or received insurance through another source. I was talking about continuous coverage for children. The reasons why, there are just limited reasons why that during that 12-month period that coverage may end. So to implement that system by a system change, we pushed out cases so that when we processed that child renewal, that we were able to grant the child that 12 months continuous coverage as part of our unwinding plan. All states, just to let you know, all states are mandated to do that effective January 1, 2024. So we were going to have to do it anyway, but wanted to be able to do it prior to that to grant that to children going through unwinding. For September, we did see 80,417 approvals. We had 16,468 terminations. And you see that we have a very large bucket of individuals pending. And that is due in part to the flexibility we implemented to extend all populations that haven't responded to a notice. So that is going to increase the number that we're going to see pending from month to month until they've exceeded their ability. We've exceeded their ability to do that extension. So again, in that bucket are both individuals we've extended from previous months, as well as the pending document processing. So we're very excited to share today our new demographic data. We just completed the creation of a demographic report that we will post to our website. We're going to be doing this starting in September and for all months going forward. This is just being able to look a little bit into the populations that are being impacted by the renewals and the unwinding. So as you can see on the far left, we have it broken down by race. And then below that, we have it by gender. In the middle of the slide, we show ethnicity. And then on the far right, we see that by age group. So we are going to be tracking this, looking at trends, and being able to share this publicly with stakeholders so that they can kind of get a glimpse into what the demographics look like of the population that's going through renewal. So we'll be reflecting approved and terminated, and not necessarily pending, but just in the approved and terminated buckets. So look for this to be posted on our website it should be shortly posted on our website. The other thing that we've been doing is tracking reinstatements. So if a member is procedurally terminated, let's say they did not respond to a notice, and so they receive that termination notice, then they have, or let's say the next day they go in and try to access services and we're told they're no longer eligible. The member can, within 90 days of their termination date, respond to that either renewal packet or the request for information, provide whatever information or verification that's necessary. And if we're able to determine them eligible, they'll be reinstated back to their termination date. Again, this happens within the 90 days after termination. This is the individual does not have to ask for reinstatement. The reinstatement will be applied once the determination of eligibility is processed. We want to acknowledge that there's been a little bit of a confusion because this is new for unwinding. And so a lot of times in the past, when a member was terminated, they have to actually go through reapplication. We've been trying to educate everyone, including our own DCVS eligibility workers, just to understand that it's not reapplication within that 90 days. It is a reinstatement, and so it can be handled a little differently. But so just keep that in mind as you're talking to folks who might be in this situation. It's just requesting that reinstatement. And one thing that we are doing is, again, just trying to make sure everyone understands what the process is. And we'll talk about that in a little bit. But so we're tracking those that happen within the 90 days past the renewal month. As you see, we've closed that 90-day period for May. We did have a little over 5,600 reinstatements that occurred. For June, 5,800 reinstatements. For July, almost 4,000 reinstatements. For August, 2,800. And even though we just recently closed on our September renewals, we've got 1,700 reinstatements so far as part of the 90-day reinstatement period. We always try to highlight what our priorities are because they can change from month to month. But one that remains the same every month is just encouraging members to respond to a notice, even if they believe they're no longer eligible. The reason for that is we really would prefer to make that determination of ineligibility rather than somebody just guess as to whether or not they're eligible. So responding to those requests for information just helps us really be able to consider all information on a member's case to see if they could potentially have the coverage that they did have, or maybe they're eligible for another type of assistance for Medicaid. The other thing we like to do is if it is a member that ends up being no longer eligible due to excess income, is making sure they understand and are connected to the ability to choose a plan on Connect, the state-based marketplace. So to go out and choose that qualified health plan so that they maintain coverage and hopefully to have no gap in that coverage. We are, as I mentioned, encouraging folks to come back in that 90-day reinstatement period. And then we've been working on implementing and taking advantage of every flexibility and strategy that's available to the state. Currently, we are utilizing 20 of the 23 CMS state strategies that they provided to states. So we're trying to do everything we can to both maximize our ex parte processing, which is where we go out and just ping the federal hub and those trusted data sources and are able to determine somebody eligible with no action from that person, as well as try to prevent the procedural terminations. So I was mentioning that we have 20 of the 23 state strategies. That doesn't include a whole bunch of other flexibilities that we've implemented since we've started unwinding. A full list of the flexibilities are on our website called the PHE Flexibility Tracker. So certainly if you're interested to see what all we're doing to try to provide some support to our Medicaid members going through renewals, please feel free to go out and look at that. These are just a couple. I've mentioned already the 2-month and 1-month extensions that we're doing for somebody who hasn't responded to a notice, but we have some others that allow us to go ahead and determine somebody eligible when before the PHE that would have been a reason for a denial or termination. For example, we can, for anybody who's at or below 100% of the federal poverty level, and we don't get a return on the data from pinging those federal hubs, we can rely on the information that was in the 12 months, the last 12-month eligibility determination. We can rely on the accuracy of that and utilize that to be able to renew the individual. I mentioned the 90-day reconsideration period. A couple of other things that we're doing with our managed care organization. So if the member is in managed care, we are using the managed care organization's contact information. They generally try to stay in touch with their members, so they may have more updated or current contact information. They're able to now send that to us, and we will consume that and update information so that we're making sure that we're reaching folks at their most current address or through other modes of communication. We are allowing managed care plans to now assist members with their renewal. So if the member is trying to navigate the renewal process, trying to understand what information is needed, the managed care organization can assist that member with understanding what the process is. They can do a virtual meeting so they can walk through the different visuals that we've provided to them to help the member understand what the next steps are to take. And again, in situations where the member may no longer be eligible, the MCO can help that member navigate and choose and understand how to choose a qualified health plan on Connect. I do want to note, and I believe we have maybe a lot of individuals on the call today that are interested in home and community-based services 1915C waivers and what's going on with those flexibilities. A couple of things to note. One is that the Appendix K, which is the vehicle in which that we were able to implement flexibilities for the 1915C waivers, is due to expire on November 11th. However, we have filed amended waivers for all 6 of our waivers to be able to maintain those flexibilities beyond November 11th. The Centers for Medicare and Medicaid Services, CMS, issued a state health office official letter that gave states guidance on how do we extend those flexibilities. And so what states have to do is file an amended waiver and incorporate the flexibilities that we want to extend and or make permanent into those waivers. Those waivers are currently out for public comment. So we will drop into the chat the link to where you can find those waivers, information about the public comment period, as well as a recording of a stakeholder meeting about what we're doing, what changes we're making to the waivers, responses to questions during that period of time. The department is absolutely committed to extending those flexibilities in those waivers as we finally do more permanent amendments in the future. So we really want to make sure folks understand that this is just an action we need to take. This doesn't mean that the waiver won't be reopened at some point to do some additional amendments. This is just the activity we have to go through to maintain flexibilities beyond November 11th. So please feel free to go check that website. And again, if anybody has specific questions around that, we are doing separate stakeholder engagement around the 1915C flexibilities. So definitely keep an eye out for that and go out and take advantage of what we already have available. Talked a lot about reinstatement. One of the things we just did, this is brand new, hot off the presses, is a reinstatement flyer. We really want to make sure all stakeholders, not just members, understand what the member needs to do if they're in that situation where They walk into the doctor's office, they find out their coverage just ended, and we want to make sure that member has access to services if they're eligible. So we've created this flyer. It's going up on our website. We do encourage our providers to have these available, community-based organizations, as you interact with Medicaid members, to make it available. We're going to be putting it up on social media as well, and we'll continue to kind of refresh the education and outreach around this throughout the rest of the unwinding period, so that individuals can understand what action needs to be taken. I think what's important to note, if the member has a Connect account and they go in post-termination, that renewal packet, that notice, the request for information, is still on their account. So this talks through how they go and find that, so they understand what they need to do, because that notice tells them exactly what information is necessary for us to make the determination. So that's the other reason we thought this might be helpful, is if that member has a Connect account, how do you navigate that account and be able to respond for your reinstatement? And also just a reminder that we do have a lot of other informational flyers and information on our website, just to try to, again, reach individuals where they are, get them information. We just so appreciate our providers being willing to provide information. We have to just, do our best as a state and all of our partners to try to help support members as they're navigating this process. Always, we touched on this a little bit, but there is a separate information available to our home and community-based providers. So this just reinforces that. The CLOCS report, Kentucky Level of Care. So our long-term care 1915C providers have access to CLOCS, and in CLOCS is the ability to create a renewal report. We have information about how you go about doing that on our website. And just trying to remind those providers that that's there and available. We like to keep this information handy. It's all the ways that a member is able to respond and complete a renewal. They can do it, again, through sending it in the mail. They can fax it. They can access their self-service portal, and we have encouraged members that don't have one to try to create one. It is the quickest and easiest way to track your eligibility and to respond to notices by, if we have mobile capabilities where they can just take a picture and upload a picture of the information. I do want to note a couple of things. It sometimes is very difficult to navigate the identity proofing that comes and is required to access a self-service, to create a self-service account. If individuals are having difficulty, we just ask them to reach out and we'll try to help them navigate that. But identity proofing is unfortunately a requirement, a federal requirement. I will note that we are looking at the whole process with COG, the Kentucky Online Gateway, that requires that identity proofing, as well as individual program identity proofing that may be required. So we are looking at it right now. There probably is not going to be something done prior to the end of the unwinding period, but still wanting to improve on that process going forward. So we are looking at it. Of course, members can call Connect and DCBS. We fully acknowledge that our wait times are not where we want them to be, and we're continually trying to work on that, bringing on additional staff. So that's why we do try to encourage members to go through that self-service portal to try to reduce the number of people that might be trying to call the contact centers. And then visiting our wonderful partners, the connectors and insurance agents, as well as local DCBS offices. Having people out in the community is a really great resource for someone who just really wants to go face to face and speak to somebody. So they're available in all 120 counties. Just a reminder to our providers that the redetermination date of a member is on Kentucky Health Net. So if you're logging in any way to determine, to verify eligibility, take a look for that date. and note it for any members that might be coming in or that you're interacting with. We sure appreciate the help in making them aware of their redetermination date, especially if it's the month, end of the month that you're seeing them, or the next month, because then their renewal is in process. So both current month and next month is really important that the member understands that they may have to take some action and to keep an eye out for that. We talked about clocks report. So again, we talked a little bit about if a member is no longer eligible for Medicaid, that they are likely eligible for a qualified health plan and advanced premium tax credits, APTC. You hear that a lot. APTC can make that premium for a qualified health plan either no cost or very low cost. So it's really critical that an individual who's lost Medicaid coverage due to excessive income to go over and see what's available to them on the exchange, because that, again, that qualified health plan might be no premium. There are also other cost sharing offsets, financial assistance available. So an individual may have no to low cost premium as well as no to low cost sharing. So lots of ways to support individuals to offset that cost of that type of healthcare coverage. The most important parts to someone moving from Medicaid to a qualified health plan is that they have to choose a plan. In Medicaid, one gets chosen for you if you don't choose. And then the second is that you do have to make that first payment for you to affect the coverage. And of course, in Medicaid, there is no premium and or cost sharing. So those two things are very important for an individual to understand who may move from Medicaid to a qualified health plan. So we are tracking just those individuals. So if they've lost Medicaid, but we can see that their income qualifies them for a qualified health plan and that APTC, we're really doing a lot of outreach to connect them to those plans. So you can see, and this is we're really happy to see this, is that the trend for the qualified health plan enrollment is going up. While you see the Medicaid enrollment go down, this you see go up. We still have a lot of folks that we are concerned are in that gap that haven't gone out to choose that plan or pay that premium, and continue to work to do outreach to those folks. And just a plug for our website, lots of information on there, including past stakeholder meetings are recorded and posted. This meeting will be recorded and posted. Our Appendix K and 1915C HCBS stakeholder meetings are around the flexibility, and Appendix K are posted on there as well. So certainly we encourage individuals to go out and utilize those resources, the flyers that we've created. And, if there's additional information that's needed, we're always listening for ways to improve communication and what's on the website, as well as flyers and informational documents that are on the website. So if you have a need and you're not seeing it fulfilled by the website, please reach out and let us know. We're definitely happy to consider changes to it. This is an iterative process as we move month to month in the unwinding period. And the reason for that is because, there's no month that's the same. Different populations are getting renewed based on our renewal plan. And so, we may see some differences in how we might need to communicate. We also get identified to us different issues. And so we're constantly maybe tweaking information to make it more reflective of what the current situation is. So again, if you haven't gone out to look at it, certainly encourage you to do so. Shameless plug for our social media. Definitely encourage you. You don't have to do all three, but maybe do one. Either like us or follow us on one of the social media platforms. It is the quickest way for us to send out information. We, within a couple of weeks ago, had a scam that was brought to our attention. And within, I think, 24 hours or less, we got something out on social media to make everyone aware of it. So we really try to keep the information to really the critically important reminders and education about what's going on with unwinding. We try not to utilize it or overuse it for anything other than what's really kind of important to keep people informed about. And of course, our stakeholder meeting, you're joining us today. It's every Thursday. And if you're unable to join, we do, as I mentioned, record those and post them. And then those reports for providers, just encouraging them to access them. And so, Helen, I know we already have some questions. I don't know. I know one thing I would like to do is go ahead and paste the site for the HCBS. I'm going to put that. What I like to do is show folks where they can find that information on the website. So this is the page, and you can, when you get to the page, you'll have to scroll kind of down to the bottom, and on the left-hand side, you're going to see updates from the Division of Long-Term Services Supports. This is where we have posted the waivers that are currently out for public comment that will have the flexibilities, the Appendix K flexibilities in them for us to be able to extend. So encourage you all to go out and look at those. This shows you, we also have the stakeholder recording for the stakeholder meeting that was held on September 25th, which is right before we posted those. So encourage you, if you're interested in this issue, to go out and look at that. Wanted to also note that on our Unwinding website, this is where you'll find the stakeholder sessions, the prior ones, as well as the ones for the HCBS and Appendix K transition. We'll continue to keep that updated. And we understand the concerns of members and providers around the Appendix K flexibilities, and we're really just trying to make sure that we're keeping you guys updated on what's going on.
Yes, thank you, Veronica. And I'll add that to navigate to that past sessions, there's a hyperlink on the main page, but also if you're specifically curious in the 1915C HCBS waiver webinars, they're also listed on the main page under the waiver participant and provider section. So you can navigate to it via 2 routes. So hopefully that is helpful. So we did receive some questions via the registration. So thank you to those who submitted. A lot of them did focus on that November 11th timeline for some HCBS and 1915C pieces that I know Veronica spoke to today. So I do think that a lot was answered in that presentation around that piece, but if you have additional questions, please feel free to chat them in. Again, recommend watching the most up-to-date presentation from our 1915C team. But if you have additional questions, we're happy to either answer them here or take them back. And then additional questions focused on sort of what the state is doing to support members as they're falling off were answered today. So thank you, Veronica, for doing so. And a couple other questions have been answered, but we have received some in the chat if we would like to start there. Thank you to those who were submitting them throughout today. I think the question there was a question on the September data for the 54,000 individuals that were pending, if there was a breakdown of those numbers. I would encourage everyone that those numbers come from the CMS report, which is also posted on our website. So you can check out all of the numbers there. And those reports do include a note that highlights the breakdown for those numbers. So in that report, you can see that 53,208 of those renewals were extended to October 23rd, and 892 were extended due to pending open document processing. That answers that question. Figured I could just, since I had it on hand. And then a couple questions are looking at the timeline that people are experiencing. And I know we did mention a couple of the volume concerns and call wait times that DCBS is having. But is there anything else to say to that, Veronica, on the timing and how these flexibilities are intended to support that to avoid members getting dropped?
Yeah, and again, I think what it is the challenge is that we are taking advantage of the flexibilities of strategies, but in the end, we do have some limitation on in our discretion, and ultimately that member might have to go through actual process of being terminated. Everything we're trying to do everything we can to prevent that procedural termination. I just encourage that understanding what our flexibilities are, and especially that if someone has a pending documentation, that they should be extended. Our system's not perfect. We're human. Our system is built by humans. And so there are times when there are issues with somebody's specific case. So if you're out there helping members and it's somebody who had documents pending, but they got terminated, that should be escalated. We need to know about that. Connectors know how to escalate cases when that's happened. And then, just really trying to help those folks post termination to be responsive. We are prioritizing cases based on age. So if somebody's been pending for a long time, both on the renewal side and application, because this is impacting applications as well. Our work load has increased 40% as a part of renewals because we had a large number of individuals that were being covered and maintained coverage through the public health emergency. So there's a lot of actions going through, and it's not our DCBS workers don't just process Medicaid. They do SNAP, TANF, child care. And so there's a lot of programs, and they all have very different requirements. So that has to play into how we're moving a case forward, how we're trying to process it. One of our flexibilities is that we have tried to combine SNAP and Medicaid cases to the same renewal date so that the caseworker is only having to touch that case once. There might be a few cases that weren't able to do that too for other reasons, but in general, that's one of the flexibilities. And if we're able to approve the SNAP, that is an automatic approval for Medicaid. So, that's another flexibility that we're leveraging. I think I just ask that you bear with us. We are in the process of onboarding a fairly large team that's being trained to help us both with processing of documents, so processing of renewals, and to kind of help maybe moves off some of that, the call frequency or the call volume to the contact centers to try to help get those cases processed more quickly. We're monitoring backlogs, doing our best to try to navigate those. That's one of the reasons we're extending. Our goal is just trying to reduce those procedure terminations through extensions, giving us additional time to do outreach, additional time to process those pending documents, but maintaining coverage for our members while we're going through those activities.
Yes, thank you, Veronica. There were a couple back and forth items in the chat around ID proofing. And so I just want to bring everyone's attention and thank Jessica Daly for putting in an example of a solution that has worked for her when experiencing this issue. And so emailing the two forms of ID to dms.idproofing@ky.gov. So thank you, Jessica, for putting that in the chat. Veronica, you noted that connectors know of the way to escalate cases, but is there any different directions or places to go for insurance agents and brokers that are supporting members through renewals? Or should we reiterate the message for flagging incidents and putting them to our radar through the correct approach?
I appreciate that question, and I'll take that back to our team to make sure that they communicate with insurance agents and brokers about what the process is to escalate cases. So we appreciate that. All
right, thank you so much. scrolling through on the chat, and I see another message from a participant noting that there aren't many editable flyers on the website. And that's great. We can absolutely take that back. I think that's important for us to know. The flyers are created so that they can be, easily downloaded and printed and sort of fit a lot of populations, but we can absolutely look into creating editable versions where you can add in direct numbers for connectors and so that your clients know how to reach you specifically.
Yeah, that's a great
So
idea.
appreciate that note. Mm-hmm.
Yeah. One thing with that, Helen, is, and perhaps the reason why we haven't done an editable version is, we want to keep the message consistent. There was a lot in preparing for the unwinding. There was a lot of conversation and discussion around how do we message? How do we make it understandable? It's a challenge because it's new to a lot of folks. We have new eligibility workers. We have new members that have never gone through renewal. So we really took a lot of time to kind of test messages, and it was also done on the national level. And our association, the National Associated Medicaid Directors, working with all the states also, we all tried to learn from each other about, what message is resonating. So we've tried to not create confusion by having different messages come from different sources. So just trying to align those efforts. And so when somebody hears about the restart of renewals at the federal level, because I know there's some national campaigns. I've seen it on TV. I've seen the commercial come on and I'm like, yay, I'm glad they're, making folks aware. But we've just tried to not create fear and anxiety amongst all the Medicaid members as we entered into this. So that balance of how do we keep people informed, but also not make sure that we're not overloading our call centers because we've sent something out and now everybody's trying to call. So, we've tried to have a plan and a strategy around common message, and we're all directing members in the same way.
Yes, agreed. And I'll reiterate on that note that while we're trying to keep the message the same, we are absolutely flexible and open to hearing what additional messages are needed, what gaps there are, and how we can help that and create sort of those downloadable, printable PDFs, but then work with connectors too. And I think we can create sort of editable flyers to get directly to connectors and agents too, Veronica, and put that out in a very streamlined way to get it into your hands. All right. So in looking at the questions that have come in, there was one regarding signing someone up for QHP. And so what is needed to get them into policy for 2024? There was an answer from someone at Connect noting that we needed to manually do that to get them into a plan in 2024. So wondering if there is guidance around that question or a place to go to ask that question specifically, since it's a direct instance.
Sure. And we might need to follow up with the person. But so open enrollment for January 2024 starts on November 1. So if somebody is needing a plan for 2024 starting January 1, then I think the best advice is to wait for open enrollment to start on November 1. Just keep in mind, and there's the information out there, I think, on our website about the special enrollment period. So for folks losing Medicaid, there is a rolling special enrollment period through July next year. So anybody impacted by Medicaid unwinding, losing that eligibility for Medicaid and needing to go over, there is no open enrollment period for you. It's a special enrollment period at any time that you lose your Medicaid coverage.
Thanks, Veronica. One question or note that I think it was more observation in the chat, was regarding the fee-for-service enrollment that's fallen lately while MCO enrollment has decreased, but at a slower rate. And wondering if we've, have a source or a reason for this disparity that may have happened. I know that we have been looking into that and researching and working with, I believe, with NAMD and CHFS leadership to figure that out and dive in. But anything that you could say to speak to that, Veronica?
After the end of the month, as we're going back and looking at the population, because I promise you, we dig into it. We want to know how many kids have been terminated, how many long-term care and 1915C members, where are the members, what are the populations that are impacted. Keep in mind, so some of it is due to the fact that we have been extending the members, so that's been building up, and we reach we exhaust that extension period. So you may see a larger number on 1 month over the other because we've just not been able to get that member respond to that notice. We are continuing to do our best to work with facilities and case managers for the 1915C and just outreaching to families to make sure that they're taking the necessary action. We have several flexibilities around this population too. And so the other thing we're trying to do is just ensure that our eligibility workers understand those flexibilities and how to apply them to the population that's going through the redetermination, so that we are making sure that we're maximizing those for the fee-for-service population.
Thank you. So we have come to the top of our hour. I really appreciate everybody taking the time to join us today. We will make sure to get this recording and the slides up on the website. Again, you can find all of our old sessions up there too. Please feel free to come to the next stakeholder session that will be on November 16th, I believe, the third Thursday of November, and we can continue to answer questions. There will be flyers should be posted to the website shortly, and please feel free to reach out to us if you should need or should you identify any other communications gaps or needs. So thank you again for everybody taking the time today, and thank you, Senior Deputy Commissioner, for giving us this update. Hope everybody has a great Thursday.
Take care, everyone.